Instead of coming in the morning wondering if you will be subjected to this abuse, it's more so how many times will I be subjected to the abuse. My journey started originally as a registered practical nurse. So I came to St. Joe's into the renal program, so on nephrology. Generally, when people go into the healthcare system as a career, they go into it with some deeply rooted motivation to help and serve others in some capacity. To know that you're going into an environment that is already challenging when you take all of the violence out of it. So there's medical complexity, there's a lot of clinical skills that the staff need. When you add in the workplace violence, it's sad that that is an added layer. Back when I first started nursing, there was a high regard for healthcare staff, nursing staff. You know, patients and visitors, they asked questions, they asked for permission, where can they be, how can they help? It was a mutual respect between us. So we gave the open communication and transparency to the families and the patients, and they gave that back to us. During COVID, there was all of those celebrations that nurses are the heroes of the healthcare system, but it didn't feel that way working as a nurse in that environment. Having behavioral patients, the name calling, the abuse that staff took was much more prevalent. I was actually quite shocked when I returned at how common it has become and how tolerant staff have become, that it's just what happens. It's no longer a shock, it's just what's expected in your shift. So it's, instead of coming in the morning wondering if you will be subjected to this abuse, it's more so how many times will I be subjected to the abuse. I did get called down one morning. I wasn't actually supposed to be on site, it was before I was supposed to start, but I was there, so I went down. The patient was quite upset. He was swearing, he was threatening staff, he was threatening staff's families. He had commented that he knows where people park, he knows where people live, he knows where they grocery shop.
How does that feel?
It makes you feel nervous. It feels like you're always looking over your shoulder. So you try to change up potentially where you park. You try to change up, I'm a very routine person, so trying to change up where you walk, what pathway you take.
How often does the subject of violence come up?
Daily. So as a manager of an inpatient unit, so where patients are staying, every morning I would wake up at home and look at my phone before I came into work and just sift through the emails of reports of what happened overnight.
What toll is that taking on yourself and your colleagues on those daily conversations?
It's causing nurses to leave frontline. People go into leadership to inspire change, to look at innovative ways to provide patient care. But there's no time for that because you're dealing with all of the daily fires of the abuse that occurs on the units. I want people to know it actually exists, that it truly is happening on a regular basis. No one here wants people to wait, but I want them to know that they're human.